In the second unit of this short course, we're going to introduce the principles of clinical checking for a prescription. Like the unit before, a short quiz will be provided at the end of this unit to test your learning. After the completion of this unit, you should understand why the clinical check is performed, be able to identify the importance of clinical checking, and have a good knowledge of the associated benefits. You should also be able to recognize the principles and skills required to carry out a clinical checking. In the UK, there are 3 elements within prescription checking. These are the legal checks, the clinical checks, and dispensing accuracy checks. The legal and clinical aspects are the professional checks that must be done by qualified pharmacists, whilst the accuracy check can be done by both the pharmacists and technicians. Elements of a legal check includes legibility of handwriting, the appropriate signing and dating of the prescription, the patient's details, medication details, and other special requirements for specific classes of drugs such as controlled drugs, also known as CDs. Morphine is an example of a controlled drug that has stricter prescribing requirements legally and clinically. For pharmacists in the UK, clinical checking is a routine procedure and is carried out before medications are handed over to the patient. It is performed by qualified pharmacists with the aim of identifying potential problems that a prescription may have. The elements of a clinical check include appropriateness of medication, taking into account patient factors, ensuring suitable dose, quantity, length of treatment, and route of administration. It also takes into account the changes to the patient's regular medications and the possibility of interactions. The main purpose for performing clinical checks is to ensure the medication supplied is safe and effective for the use by a patient. Recent studies have shown that clinical input made by a pharmacist can reduce the number of prescribing errors. As pharmacists are patient-facing, they serve as the final line of defense for the prevention of prescribing errors. This is because they have the opportunity to review the patient's medication and can identify and inform the prescriber of any errors prior to dispensing. This procedure requires the gathering and evaluation of all relevant information, including patient characteristics, disease states, medication regimen, and potential laboratory results. By using a structured, logical approach, clinical checking can support the pharmacist to weigh up the risks and benefits of a prescribed medication, and can improve the safety and effectiveness of the medication prescribed. However, the process is often much more complex than a simple dose and interaction check. Instead, it involves a wide range of skills and often requires communicating with patients and prescribers. The pharmacist can also utilize their expertise in human pathophysiology and pharmacology along with their clinical experience to make professional judgments. Before you can perform a comprehensive clinical check, you must first obtain all the relevant information. However, the sources of information can vary depending on the pharmacy setting. Realistically, it is often that the pharmacist cannot obtain all the information needed and requires professional judgment based on the limited information available. In community, information can be obtained from the prescription that a patient brings in, the patient themselves, their representative, carer, or their GP. Other sources such as the patient's medication record can also be utilized to support any decisions you may make. In hospitals, sources of information are often sought from other healthcare professionals involved in the patient's care, medical and nursing notes, ward charts, and laboratory results. After all the relevant information is obtained, there are 3 key areas you need to consider during a clinical check. These are the characteristics of the patient, the medication regimen, monitoring requirements, and aspects related to the administration of the medicines prescribed. So, let's start by talking about some of the important patient characteristics that you may need to consider. These can be things such as the type of patient you're performing the clinical check for, as you will need to establish that the patient does not fall into a group where the treatment is contraindicated or cautioned. Be aware of specific vulnerable groups of patients, such as children, elderly, and pregnant or breastfeeding women. Gender can be important in some cases, as there might be medicines that are not suitable for a particular gender. You will also need to consider the difference in drug effects between different ethnic groups due to genetic differences. For example, the starting and maximum dose of rosuvastatin, a cholesterol-lowering drug, is often lower for patients of an Asian origin than for Caucasian patients. Next patient characteristic to consider is whether they suffer from any other conditions, as comorbidities, such as renal or hepatic impairment, can make the use of certain treatments highly inappropriate with the potential to cause harm to the patient. In other cases, such comorbidities may require you, as a pharmacist, to make appropriate dose adjustments according to the severity of their condition. Lastly, you will need to take into account any intolerances or preferences that a patient may have for their medication. This can be in the form of allergies, dietary intolerances, vegan diet, and religious beliefs. For example, a patient who's vegan or those from certain religious backgrounds may not be able to consume products containing pork or gelatin, which is commonly found within capsule formulations. After you have evaluated the type of patient that the prescription is for, the next point to consider is their medication regimen. Using a logical and structured method during a clinical check is often the best way to ensure you do not miss anything important. First, you look at the indication, ensuring that the choice of treatment is appropriate and is compatible with relevant guidelines. You then look at whether there have been any changes in the patient's regular medication. If changes have been made, you should check that they were done for an appropriate reason and not by mistake. Next, you should check if the dose, frequency, and strength of the drug are appropriate in relation to the individual patient characteristics mentioned previously. It can also include things such as the weight of the patient and their lifestyle patterns. Once you have ensured the dose and regimen is appropriate, you may need to check whether they are appropriate for the formulation that has been prescribed, as certain formulations have pharmacological differences that may result in a change of frequency or dose. After ensuring the regimen for the medications prescribed are appropriate, you should look at whether the medications are compatible with each other, as regular and new therapies must be evaluated for any clinically significant interactions and duplications. Lastly, for medications or conditions that require monitoring, you should check for patients' latest results and make adjustments accordingly. Finally, you should finish your clinical check by looking at the aspects related to the administration of medicines. These include factors such as the route of administration, ensuring that it is appropriate for the patient. For patients that may benefit from the use of an adherence aid, such as the elderly, you as the pharmacist should consider their benefits. Examples of such aids are calendar packs for polypharmacy, spacers for inhalers, devices that help the administration of eye drops, braille, and other special labels. You should also consider any additional information that may help the patient in administering their medications. We will now take you through an example of a typical clinical check. In this example, we have Mr. Robert Drake, who has come into the pharmacy to pick up a prescription for a new medication to help with his rheumatoid arthritis. Assuming the legal checks has been done, we should start by checking the patient's details, such as age and gender. As the patient is present, we can ask him if he suffers from any other medical conditions, taking any other medications, or have any allergies. The information obtained will be useful in assessing whether there are any contraindications, cautions, harmful interactions, and intolerances. If there was a problem, such as if the patient is suffering from renal impairment, it is down to the pharmacist to assess the need to alter the dosage of their medication or to explore alternative therapies. To check that the medication prescribed is used for the appropriate reason, pharmacists in the UK often refer to a book known as the British National Formulary, which clearly states all indications and dosages in relation to a particular treatment. In this case, the BNF states methotrexate 7.5 mg is to be taken once a week for the treatment of rheumatoid arthritis, and agrees with the instructions on the prescription. After confirming that the drug is safe to be used by the patient, we should consider the aspects related to the administration of the medication. Methotrexate, along with certain other medications, are often prescribed on a once-weekly basis. Therefore, we need to consider advising the patient on the dose and frequency to minimize the risk of the patient taking more tablets than he's supposed to. Lastly, we should think about the potential issues that the patient may have for taking the tablets, as dexterity issues are often experienced by patients suffering from rheumatoid arthritis. We have now reached the end of this unit on clinical checking. You should now understand why clinical checks are performed and its importance in relation to improving the safety and effectiveness of medicines used to treat a patient. You should also gain a basic understanding of the key aspects within the clinical checking process. We hope this unit has given you sufficient information for you to build your knowledge and create your own structured approach in order to improve your competency when it comes to performing such checks. Stay with us for the next unit on the Medicine Use Review Service carried out in the UK.